What do you think should be our highest priorities in the fourth quarter of each year to optimize our MIP scores?
Great question, June. Let's walk through the performance categories one by one to comment on them. First, promoting interoperability, or PI. By the fourth quarter, there's not much you can add to your promoting interoperability score. You're down to your last possible 90 days of time to generate a final score. And remember, the proposal for 2024 is to increase this to 180 days. Starting in 2024. You can still get credit for exchanging data, for e-prescribing, or for checking your local PDMP or prescription drug management program when prescribing controlled substances. But most measures will take some development and implementation time, which is sorely lacking in that fourth quarter of the year. Now, as for practice improvement activities, IA, again, you need 90 days of participation for half of your providers to score on this activity. The fourth quarter is a little late to get started on anything new, and it's kind of the last minute also to get your participation up to 50%. Now, as far as cost, with 3/4 of the performance year now in the past, new cost containment activities won't have a big effect on your current year scores. Finally, quality. Your biggest opportunity for improvement in the fourth quarter of the year lies in your quality scores. Why cost? 3/4 of your performance year is already passed, but there are still some important opportunities to optimize your scores. Many measures look for the most recent activity, like blood pressure, hemoglobin A1C, colon or breast cancer screening, immunizations. If you've been monitoring your quality scores right along, it's a good time to generate a list of your eligible patients who are not yet in the performance MET status. You should check charts to see that MET performance has been reflected in your scores. If it's not, it's a good time to correct your documentation so that MET performance is picked up by your measurement system. Related to that, it's a good time to supplement the training of your clinical staff so that future care is documented in a way that is captured by your measurement system. If you're doing ECQMs, correction of your documentation is the only way to improve your scores. But if you're doing MIPS CQMs through a registry or Medicare CQMs, correction of your documentation is not your only means of improving your score. Your registry may be able to accept a spreadsheet of abstracted patient data, that's manually abstracted patient data, to more accurately reflect your great care and improve your scores. One of the main benefits of MIPS and Medicare CQMs over ECQMs reporting is the ability to combine data sources, including both digital and manual collection techniques for more accurate blended quality submission. Your spreadsheet will need to include the pertinent patient identifiers, the date the observation was clinically generated, and the nature of the observation. You should be able to get a template for this from your registry, and we provide those for our clients. You want to have enough data in the spreadsheet to be able to go back to the chart and prove the measurement if you are audited. If your patient will be coming in for a visit, you can provide and document the performance met care before the end of the year. And don't forget that many measures can be met if the intervention is provided remotely or not face-to-face. Your staff can go through a list of your not met patients and by phone schedule the interventions that are required to bring them up to date. In review, fourth quarter of each performance year is a great time to improve your quality scores. Double check your quality scores, provide missing elements of performance met care in a visit or non-visit method, finding and correcting documentation errors, supplementing your registry submission with manually abstracted quality data. For the other three performance categories, that's PI, promoting interoperability, IA, improvement activities, and cost. Though you have limited opportunity to improve your scores, it's a great time in the fourth quarter of the year to be generating a wish list for next performance year improvements. Thanks, June.